Hello everyone. Today I will narrate another previous topic from rheumatology, Sjögren syndrome and systemic sclerosis, so that you can easily solve the previous question and manukibang from the same topic. So let's start with Sjögren syndrome. It is an autoimmune disorder characterized by destruction of exocrine gland. As it is autoimmune, it is predominantly seen in female 40 to 60 year old. HLA-DR3 association. If it is secondary, it is associated with other autoimmune disorder, for example rheumatoid arthritis, SLE, systemic sclerosis, or if it is only Sjögren, it is a primary disorder. Rheumatoid arthritis is the most common cause of secondary syndrome. Among findings, we can see the inflammatory joint pain. Most common extraglandular manifestation is arthritis in Sjögren syndrome. Also keratoconjunctivitis sicca, xerostomia, and presence of antinuclear antibody and rheumatoid factor. The anti-Rho or SSA and anti-La SSB, it is also seen in Sjögren syndrome. There is also bilateral parotid enlargement. Among complications, there is dental caries, mild lymphoma, increased risk of giving birth to baby with neonatal lymphoma. Focal lymphocytic sialadenitis on labial salivary gland biopsy can confirm diagnosis. The HL is very commonly asked topic in NEET PG. You can watch the YouTube video from Dr. Nikita. She has the mnemonic video from HLA. DR2 and DR3 associated with SLE. DR3 also associated with Sjögren. DR4 rheumatoid arthritis and B27 seronegative arthritis. Systemic sclerosis or scleroderma. It is a triad of autoimmunity, non-inflammatory vasculopathy, and collagen deposition with fibrosis. Just like Sjögren, it is also more common in female. Commonly, sclerosis of skin, manifestations on puffy, taut skin without wrinkle, fingertip pitting, can also involve other organs like renal, pulmonary, GI, cardiovascular. The scleroderma renal drug of choice is AC inhibitor. The most common histological pattern of interstitial lung disease in systemic sclerosis is non-specific interstitial pneumonia. But in case of rheumatoid arthritis, the most common type is usual interstitial pneumonia. You should remember the drugs and the chemical implicated in systemic sclerosis like illness. These are asked in exam. Scleroderma mainly has two types, diffuse and limited. The diffuse type is rapidly progressive and widespread skin involvement, but the limited type is slow progressive and limited skin involvement confined to finger and face. The diffuse type, there is skeletal myopathy or sclerodermal renal crisis are more severe. But in case limited, the calcineous cutis, the Raynaud phenomena, and the esophageal dysmotility are more common. In case of pulmonary manifestation, the diffuse type has the interstitial lung disease more, and the limited type has pulmonary arterial hypertension more. Autoantibodies, the CREST syndrome consists of 5 things. I have discussed the first three: calcineous cutis, Raynaud, and esophageal. Also sclerodactyly and telangiectasia. C also stands for anti-symptomatic antibody. Overall, most sensitive test for systemic sclerosis is ANA. Cyclophosphamide and bosentan are used in treatment of scleroderma. Cyclophosphamide reduces the progression of ILD associated with scleroderma, and bosentan reduces the risk of new ulcer in Raynaud phenomena associated with scleroderma. Raynaud phenomena, it is the most common extracutaneous manifestation of the scleroderma. Here there is decreased blood flow to the skin in response to cold or stress. So the finger color change from white to blue to red. Most often in finger and toes. So the primary disease is more common in young women. Family history positive, no association with other diseases, less severe, no digital necrosis or ulceration or pain. AN will be negative, and nail fold capillaroscopy shows normal capillarity in evenly spaced palpebral loops. The secondary Raynaud phenomena, it is more common in older women, no family history associated with other diseases, more severe. Digital necrosis or ulceration can be seen. AN test will be positive, and the nail fold capillaroscopy will show distorted capillary with widened and irregular loops. Treatment with calcium channel blocker. So in next video we will discuss another topics from rheumatology.